Nurses are the unsung heroes of healthcare, the vigilant guardians of patient well-being. They are the first line of defense, the keen observers who detect subtle changes in a patient's condition. Among the many tools at their disposal, telemetry stands out as a critical instrument for monitoring heart rhythms and detecting abnormalities. Telemetry provides a continuous stream of information about the heart's electrical activity, allowing nurses to identify potential problems before they escalate into life-threatening situations. Imagine a patient admitted for chest pain. Their electrocardiogram, or ECG, initially appears normal, but telemetry reveals intermittent episodes of tachycardia, a rapid heart rate. This early detection allows for prompt intervention, preventing potential complications like heart failure or stroke. Telemetry empowers nurses to provide proactive care, ensuring the best possible outcomes for their patients. The ability to interpret telemetry strips is not just a skill, it's a lifeline. It allows nurses to make informed decisions about patient care, from administering medications to initiating life-saving interventions. Telemetry is an indispensable tool in the nursing arsenal, a testament to the crucial role nurses play in safeguarding patient health. The electrocardiogram, often referred to as an ECG or EKG, is essentially a window into the heart's electrical activity. It's a graphical representation of the electrical impulses that control the heart's rhythm, displayed as waveforms on a screen or printed on paper. Understanding the basic components of an ECG is paramount for interpreting heart rhythms and identifying abnormalities. The ECG consists of several distinct waveforms, each representing a different phase of the cardiac cycle. The P wave, the first blip on the ECG, signifies the depolarization of the atria, the heart's upper chambers. This electrical impulse triggers the atria to contract, pushing blood into the ventricles, the heart's lower chambers. Following the P wave is the QRS complex, a more prominent spike on the ECG. The QRS complex represents the depolarization of the ventricles, the heart's main pumping chambers. This electrical surge causes the ventricles to contract forcefully, propelling blood throughout the body. Finally, the T wave, a gentle dome-shaped wave following the QRS complex, represents the repolarization of the ventricles. Repolarization is the process of electrical recovery, preparing the ventricles for the next heartbeat. Each waveform on the ECG provides crucial information about the heart's electrical activity, and any deviation from the norm can signal an underlying problem. The shape, size, and duration of these waveforms can reveal a wealth of information about the heart's health. For instance, an elevated T wave, a taller than usual T wave, can indicate hyperkalemia, a condition characterized by high potassium levels in the blood. Hyperkalemia can disrupt the heart's electrical stability, potentially leading to life-threatening arrhythmias. Conversely, a depressed or inverted T wave can suggest myocardial ischemia, a lack of adequate blood flow to the heart muscle. The ST segment, the flat line connecting the QRS complex and the T wave, is another crucial indicator of the heart's electrical well-being. An elevated ST segment, a bump in the ST segment above the baseline, is a hallmark of acute myocardial infarction, commonly known as a heart attack. It signifies that a portion of the heart muscle is not receiving enough oxygen and is in imminent danger of damage. Conversely, a depressed ST segment can indicate myocardial ischemia or other cardiac abnormalities. The P wave, while seemingly insignificant, plays a vital role in determining the origin of the heart's rhythm. In normal sinus rhythm, the heart's natural pacemaker, the sinoatrial or SA node, initiates each heartbeat, generating a P wave followed by a QRS complex. The presence of a P wave before each QRS complex indicates that the rhythm originates in the SA node. Finally, the QRS complex provides insights into the electrical conduction through the ventricles. A narrow QRS complex, typically less than 0.12 seconds in duration, suggests that the electrical impulse is traveling through the ventricles normally. Conversely, a wide QRS complex, exceeding 0.12 seconds, indicates a delay in ventricular conduction, potentially caused by a heart block or other conduction abnormalities. The heart, an intricate organ, beats rhythmically thanks to its internal electrical system. This system generates electrical impulses that travel through the heart, stimulating its chambers to contract and pump blood. Normal sinus rhythm, the most common and desirable heart rhythm, reflects the heart's natural pacemaker, the sinoatrial or SA node, effectively controlling the heartbeat. In normal sinus rhythm, each heartbeat originates in the SA node, located in the right atrium, the heart's upper chamber. The SA node generates electrical impulses at a regular rate, typically between 60 and 100 beats per minute in adults. These impulses travel through the atria, causing them to contract and push blood into the ventricles, the heart's lower chambers. Sinus bradycardia, a slower than normal heart rate, occurs when the SA node fires impulses at a rate less than 60 beats per minute. While bradycardia can be a normal finding in athletes and during sleep, it can also indicate an underlying problem, such as hypothyroidism, electrolyte imbalances, or heart block. Sinus tachycardia, a faster than normal heart rate, occurs when the SA node fires impulses at a rate greater than 100 beats per minute. Tachycardia is a natural response to exercise, stress, or fever, but it can also signal an underlying condition, such as hyperthyroidism, anemia, or heart failure. Sinus arrhythmia, a common and usually benign variation of normal sinus rhythm, is characterized by fluctuations in the heart rate. These fluctuations are often linked to breathing, with the heart rate slightly increasing during inhalation and decreasing during exhalation. Sinus arrhythmia is typically harmless and requires no treatment.